statements. The first statement, Mr. Speaker, concerns matters of health. Mr. Speaker, I will make this statement both as Prime Minister and as the CARICOM lead head on matters to do with health and human resource development. The year 2020 will forever be remembered as a most trying one. The COVID-19 pandemic tested the resilience of every nation. For the first time in our lifetime, the singular action of an individual could have had far-reaching consequences for all of us. It was also a time when leadership mattered, and it still does, and countries that did not lead their people with a well-defined strategy to address the pandemic have suffered dire consequences. Unfortunately, the consequences were mounting COVID-19 infections and death. To date, there are 109,217,366 confirmed cases globally, with 2.4 million deaths, and that is according to the WHO website as at 9 p.m. February the 17th. Of course, this is a moving target, and every minute and every hour, the numbers do change. We have seen great nations with huge resources struggle to contain this deadly virus. We need only look to our most powerful neighbor to the north, the United States of America, where they have had a record of 27,820,237 cases and over 490,160 deaths. The Caribbean was not spared the ravages of the COVID-19 pandemic. And the most recent situation report from the Caribbean Public Health Agency, CARPHA, showed that among our 26 member states, there were 100,952 confirmed cases and 1,813 deaths. United Kingdom overseas territories also struggled with 1,947 cases and 20 deaths reported. Many of our member states saw their numbers peak in December, following the opening of their borders and an increase in international tourist traffic from known hotspots in Europe and North America. Some of the reasons posited were to prevent the economy from collapsing, as in addition to fighting the pandemic, there was a veritable fight for economic survival. Here in our Federation of St. Kitts and Nevis, we thank the Almighty God that we have fared better than most. This was, however, not by chance, but as a result of the visionary collective leadership of my government, with science at the core of every decision we made. Our shrewd fiscal management over the past 6 years since Team Unity has been at the helm gave us the economic latitude needed to enhance our health preparedness and keep the entire economy afloat, despite a near closure of one of our major income generator, the tourism sector. In St. Kitts and Nevis, we struck the delicate balance between lives and livelihoods in this fight. At every step, making the safety of our people our primary focus. As I mentioned a few days ago in my address to the nation, our outstanding management of the COVID-19 pandemic has caused us to be recognized internationally as the country with the lowest rate of confirmed cases and having the lowest COVID-19 risks in the hemisphere. The World Health Organization issued guidance on the management of the pandemic to all nations in January of 2020, but warned that there was no one-size-fits-all approach. We look at best practices around the globe, but here in St. Kitts, we crafted a simple but effective four-pronged strategy to the management of the COVID-19 pandemic. It is worth repeating the approach and the successes we have had at each stage of the journey so far. Firstly, our plan was to keep the virus at bay for as long as possible, which we did. Secondly, our plan was then to limit hospitalizations and deaths and avoid community spread until a vaccine arrived, as this is the only thing that would end this pandemic, and we have done so successfully so far. Of the 2,413,912 deaths globally and 1,813 deaths from the 15 member states of CARICOM, there has not been a single death from COVID-19 in the Federation of St. Kitts and Nevis. We thank God for this. The success then of this element of our strategy cannot be overstated. The third element of the plan is to limit the gap between community spread and vaccine availability, noting that community spread is a distinct possibility if the virus is being imported. We have been successful at this again, as our vaccines are here, at least some of it, and we remain one of the few places in the world without community spread. We are now, Mr. Speaker, on our fourth element of our strategic plan to restore our country to normalcy. I am therefore pleased to announce that our vaccine rollout will begin this coming Monday on the 22nd of February 2021. Our aim is not just for coverage of 20% of the population, as is the goal of the COVAX facility, but to have more than 70% of our population coverage, thereby achieving herd immunity and wide-scale protection of all our people here in St. Kitts and Nevis. While we work on our immunization plan locally, as the CARICOM's lead head on health matters, it is my duty to inform you of our regional effort also. This, of course, is being coordinated by the CARICOM Secretariat in close collaboration with regional institutions such as CARPHA, CEDIMA, IMPACTS, the UWI, the OECS Commission, and PAHO, all working closely, almost on a daily basis, with member states, mainly through their heads of government, the Secretary General of CARICOM, Ministers of Health, the Assistant Secretary General of CARICOM, and our Chief Medical Officers within the region. Currently, member states are at various stages of preparation for vaccine rollout, with some already having a soft launch, while the majority are in their final stages of preparation for a full national launch, which will be based mainly on procurement via the COVAX facility, and delivery in this regard is expected to begin shortly. There are a number of regional initiatives to procure vaccines. These include 1.5 million doses from the African Medical Supplies Platform, AMSP acronym, initially, with options for more as supplies improve. These vaccines will be coming from the Pfizer, AstraZeneca, and Johnson & Johnson. We are aware that the Johnson & Johnson vaccine has not yet received emergency use authorization, but all the experts are confident, based on the phase 3 clinical trial results, that it will be released for use very soon. The Secretariat, that is CARICOM Secretariat, is coordinating this avenue for vaccines via regular contact with the AMSP. We will therefore be updating you when these vaccines become available. We intend to deliver these vaccines into the arms of individuals at no cost, as finance will not be a barrier to the lives we save. The vaccines are, however, not free, and we have had to look at ways to undertake this massive vaccine rollout in the region. The CARICOM Secretariat has been meeting with the international financial institutions like the World Bank, the Inter-American Development Bank, and the Caribbean Development Bank, exploring options for concessional financing for member states. With respect to the CDB, the Caribbean Development Bank, that is, member states are initiating discussions, especially to address financing coverage of vaccine in excess of the 20% covered by the COVAX facility and donations. The fight against this deadly virus requires a global response, and no one is safe until everyone is safe. The chair of the Conference Heads of Government of CARICOM has written to the Director General of the World Health Organization to convene a summit to make the case for equitable and affordable access of vaccines for vulnerable countries like those in CARICOM. As the CARICOM lead on health matters, I am following up with the Access to COVID-19 Tools Act A Facilitation Council to ensure the rollout of the initial 20% allocation of vaccines to member states through the COVAX facility. Returning home to St. Kitts and Nevis. The St. Kitts and Nevis vaccination plan, our vaccine rollout, is ready. We will be starting with a phased approach, and the main goals are: 1, to prevent death and serious disease as much as possible; 2, preserve the orderly functioning of our society; and thirdly, to reduce the extra burden COVID-19 is having on people, particularly those facing vulnerabilities. Our plan is to ultimately access enough COVID-19 vaccines to vaccinate at least 70% of our population to achieve the herd immunity threshold. We are in the process of expanding the storage capacities for vaccines at our 2 main hospitals. The vaccines will be transferred from these central storage points to the 17 health centers located on Nevis and on St. Kitts, which are the designated vaccination sites and both islands. The Pan American Health Organization is providing technical support as we speak by training the community and public health team to guarantee success of this vaccine implementation program. Given the global demand and the fact that supply has lagged, the National Immunization Committee developed a prioritization framework to guide the vaccination process, which will occur in 3 phases. The plan outlines each of the target priority groups to be vaccinated in each phase. The Ministry of Health is partnering with our IT department to develop a registry which is being populated with names of persons to be vaccinated and a database to facilitate COVID-19 vaccine safety surveillance. The comprehensive communication strategy will guide the education campaign to inform the public and generate the expected demand for the vaccine. Traditional and digital media will be utilized to disseminate the relevant content. Key stakeholders will be engaged to ensure success and in keeping with the all-of-society approach adopted at the beginning of our national response to this pandemic. The vaccine plan, of course, must be and is a living document, and it will be updated accordingly. Why take the vaccine? We want every citizen and resident, Mr. Speaker, who is eligible to receive the vaccine to take it. By taking the vaccine, you are not only protecting yourself, but those around you, and those who are too young, too frail or ill to take the vaccine. There is, we are aware, a global anti-vaccine campaign that has impacted our citizens and residents, and it has created a real challenge to our efforts to fight the COVID-19 pandemic. We believe that vaccination is a most important tool in the fight to end this pandemic and ensure a return to normalcy. A regional communications unit to promote vaccine acceptance is currently being prepared and coordinated by CARPHA and the CARICOM Communications Unit. This will work in conjunction with our own national efforts that have already begun with our health team. Everyone should note that the primary objective of the vaccines is to prevent serious illness, which may also lead to death. There is no better reason to accept the vaccine than that of saving your life and that of your loved ones. The vaccines are safe, with no significant side effects so far, and they have undergone significant testing to ensure their efficacy and safety. Higher rates of vaccination will eventually reduce the rate of infection, illness, and deaths. But also, it will reduce the possibility of new variants, since more infections equal a higher chance of mutation to new and possible dangerous variants. This is a novel disease, and so much is still yet to be learned. However, the existing vaccines have all shown from trials data to be effective in preventing serious illnesses and deaths. The importance of taking the vaccine cannot be overstated. Even if you survive the infection and recover, there is the possibility that you may get what is described as long COVID-19. This is generally defined as the lingering effects in some persons infected by the virus. These persons show symptoms or complications beyond the 4 to 12 weeks period considered to be the usual expected time for recovery from the infection. This has been found in all levels of infection, from mild to severe. Some of the symptoms are very serious, and again, because of the unknown characteristics of the disease process, more reason we should all give serious consideration to taking the vaccine. Prevention is surely so important, since we don't know what lies beyond the infection. We continue to put all our national efforts into helping you to survive this pandemic. And that is why our COVID-19 pandemic response is really a life-first strategy. Our region continues to work assiduously with partners, regionally and internationally, and nationally, of course, to combat this challenge. CARICOM is a global success in its vaccination programs for children, among the highest rates of vaccination globally. The expanded program and immunization, we have the experience within the region, and we certainly have the commitment. We can lead again with vaccination of adults against the COVID-19. In other words, the success we have had in the region with vaccinations from school days and preschool days all to this point in time is seen as a global success story. And as we face the pandemic now, we are calling on every citizen and resident who has been identified as a suitable candidate for the vaccine to take that vaccine. In the end, the life we may save may very well be our very own. I therefore look forward to hear that our people selected to receive the vaccine in the first rollout, and the subsequent ones, of course, turn up in their numbers to receive it, thereby protecting themselves and their loved ones. Senior health officials and my cabinet colleagues will take the first shot on Monday as a demonstration of our confidence in the safety and the efficacy of the vaccine. May God continue to help us, Mr. Speaker.